PanKind collaboration grant I'm currently working on is called Nectar Consortium, which is mainly looking at how the chemotherapy response occurs in pancreatic cancer patients. So we have patients who are treated with neoadjuvant chemotherapy, and this grant is mainly looking at how these patients respond to chemotherapy. So we are looking for biomarkers in blood which can predict which patients will respond to chemotherapy or not. The grant also focuses on finding new therapy so that patients who don't respond to chemotherapy can be resensitized to chemotherapy again. This research is really important because what we have seen in clinic is like pancreatic cancer patients, like their tumors are like highly resistant to chemotherapies. A lot of patients, like in our experience, almost more than half of the patients don't respond well to chemotherapy, which is the only available drug option for these patients. So finding alternate therapies which can be combined with chemotherapy will be really beneficial for the patients, and also selecting patients who will respond well to chemotherapy or not and give them a personalized medicine approach will be a really good option for them. The PanKind funding has enabled my team to get a dedicated personnel to work on this project. So we got a research assistant for particularly focusing on this project, as well as it has allowed us to buy consumables to perform this research study on bench. I'm incredibly passionate to work in pancreatic cancer because of multiple reasons. Like, it's a very challenging cancer to work on, and from the start, I wanted to work on something very challenging. And like being at a clinical site, we get to interact with a lot of patients and their families, and it really motivates us to work towards this disease, which has a very poor survival outcomes. And talking to them really motivates you all the time to work towards better outcomes in future.